Okay, welcome back, guys. Good evening, everyone. Hope everyone is doing good. Guys, in this today's class, we are going to start with general pathology. Okay, simultaneously, on one hand, on one side, we are doing general physiology. In a week, I will be doing 2 days of general physiology and 2 days of general pathology. So, today we are going to start with our first chapter in general pathology, that is cell injury. Okay, so in today's class and tomorrow's class, the two classes will be doing the cell injury, followed by the other chapters in general physiology like inflammation, neoplasia, and go on. Okay, so now see general pathology. Okay, general pathology is very important when compared to systemic pathology. Okay, in all the exams whatever you take, general pathology accounts for the most. And general pathology is so much important because even you can study the systemic pathology with other subjects. Something like in medicine, you can cover systemic pathology. Some points of systemic pathology will be covered in the medicine. Systemic pathology can also be covered a little bit in pediatrics, gynae. Like, you can have a pathology even with the other clinical subjects. But general pathology, this one area, which includes the chapters like cell injury, inflammation, neoplasia, genetics, immunology, all this should be like dealt here in pathology itself, not with the other clinicals. So this area is very important even for your exams. Having said that, right now in this today's class, we are going to start with cell injury, our first chapter. Let's try to make this cell injury as easy as possible. Okay, as easy as possible, as straightforward as possible. Let's don't go around the bush. Just simply know the points which I am going to say to you. Just know these points, and these points are going to be enough for your regular exams. Okay, now having said that, let's start our topic, guys. Cell injury. Our chapter is cell injury. Now here in cell injury, now the two important questions which will be kept on coming in the exam are: what is the most common cause of cell injury? The most common cause of cell injury. Can anyone tell me what is the most common cause of cell injury, guys? The most common, why a cell is getting injured? In the name itself, it says cell is getting injured. What is the most common cause? The most common cause is hypoxia. Okay, hypoxia. Now, what exactly do I mean by hypoxia? Hypoxia means oxygen delivery to the cell is getting decreased. There is not enough amount of oxygen for the tissues or for the cells. Now, what is the most common cause of hypoxia? Why there is hypoxia? Why oxygen is not sufficiently being delivered to the tissues? The most common cause of hypoxia is ischemia. Okay, ischemia. So what exactly do we mean by ischemia? Ischemia means decrease blood flow. Decrease blood flow. Okay, blood flow. So if you decrease the blood flow to any organ, automatically what happens? Oxygen delivery will also be affected. So that causes hypoxia. Now here I want you to know, especially in the exam point of view, what are the different types of hypoxia? Okay, so what are the different types of hypoxia which you should know for your exams? Why? Because this is kept on being asked. I want you to know 4 different types of hypoxia, out of which the first type is hypoxic hypoxia. Hypoxic hypoxia. Okay, hypoxic hypoxia. What do I mean by hypoxic hypoxia? In which conditions the patient, a particular individual will have this hypoxic hypoxia means? Say for example, in high altitudes. See, whenever you go to high altitudes, whenever you are going for a mountain trekking, see, whenever you go to high altitudes, what happened there? There, the oxygen tension is going to be decreased. Okay, in that high altitudes, the oxygen tension or the oxygen partial pressures are going to be decreased. See, the name itself is there. First of all, oxygen itself is not there in those high altitudes, and that is the reason for your hypoxia. So outside environment is hypoxic, so that causes hypoxia in your body. So hypoxia is going to be seen in those places where, like, those conditions, when you go to high altitudes. And the second type of hypoxia is anemic hypoxia. Anemic hypoxia. So what exactly do we mean by anemic hypoxia? See, outside oxygen is absolutely normal. There is no problem with the oxygen in the environment. And here the problem is, in this condition, anemic hypoxia, the problem is, see, anemia. In the blood, anemia means there is decreased hemoglobin. We all know hemoglobin is a carrier of oxygen. Here the problem is with the hemoglobin. As this carrier is not properly available, the oxygen is not being delivered to the tissues. There is no problem with the oxygen outside. The problem here is carrier deficiency, or there is no proper availability of the carrier molecules, or the hemoglobin molecules. So anemic hypoxia, okay, so decrease carrying capacity, okay, so decrease carrying capacity, guys, means the hemoglobin problem. Now sometimes this kind of question will cause, in which of the following conditions you will have anemic hypoxia? The very good example is carbon monoxide poisoning. Carbon monoxide poisoning. So what exactly do we mean by carbon monoxide poisoning, guys? If, for example, I got caught in a place where there is too much amount of fire. There is fire in this building, and everywhere there is smoke. So we all know carbon monoxide is present in the smoke. Now we have studied from our class 11th and 12th, carbon monoxide is having higher affinity for the hemoglobin. In my body right now, in my body, there is this hemoglobin present. What happened? Screen goes black. Finger. Now, okay, now it came. Okay, now it came. Okay, now see, we have studied that carbon monoxide. Carbon monoxide is a molecule which is having higher affinity for the hemoglobin molecule. Now, hemoglobin have 210 times higher affinity for the carbon monoxide. So, what just happened? Now, I got caught in a room where there is so much amount of carbon monoxide. Now, that carbon monoxide is binding with the hemoglobin, so that oxygen cannot be able to bind to the hemoglobin. So, hemoglobin is there, but is it useful? No, it's just like an anemic condition. So, just know this one point: carbon monoxide poisoning will cause which type of hypoxia? Anemic hypoxia, problem with hemoglobin. Okay, now the third type of hypoxia which I want you to know is stagnant hypoxia. Stagnant hypoxia. Now, what exactly is this stagnant hypoxia? See, at the end of the day, there is problem, hypoxia. Now, what is this stagnant? Means the blood is not moving. Hemoglobin is okay, outside oxygen is okay, everything is okay, but the blood is not properly being delivered to the tissues. The perfusion to the tissues is being affected. Why? Might be because of heart failure. Heart failure, or we can say congestive heart failure in specific. Congestion is there in the body. Congestive heart failure. Congestive heart failure, where blood is not being properly perfused to the tissues. Okay, that's causing the ischemia. And next one, see, if you have any doubts, you can all the time ask me. I'm just seeing the chat box. Okay, if you have any doubts, you can all the time ask me. Now, last type of hypoxia which I want you to know is histotoxic hypoxia. Histotoxic hypoxia. Now, what exactly is histotoxic hypoxia? Again, at the end of the day, the problem is hypoxia. Oxygen is not properly available to the tissues. Why? Why? Because there is some problem in the tissue right now. Where is the problem? Problem is in the tissue, sir. What exactly is that problem? See, let me give you the example here. Example is cyanide poisoning. Now we all know cyanide is a poison. Now whenever you take cyanide, what will it will do? Now the cyanide will go into your tissues. Now in your tissues, now there is something called as, in each and every cell there is something called as electron transport chain, and there are different complexes. Okay, complex number 4, especially complex number 4 of electron transport chain etc is going to be inhibited. Now whenever there is cyanide poisoning, what is happening? This cyanide is getting into the tissues, into the cells, and in the cells the electron transport chain, especially the complex 4 of the electron transport chain is going to be inhibited. So that what happens? Now the tissues cannot utilize the oxygen. Oxygen is there, but the tissues cannot utilize the oxygen. So at the end of the day, hypoxia is happening. Now I will ask you two questions, guys. Just try to answer yourself. Cyanide poisoning will cause which type of hypoxia? Hypoxic hypoxia? No, cyanide poisoning will cause histotoxic hypoxia. Carbon monoxide poisoning will cause. Carbon monoxide poisoning causes anemic hypoxia. Whenever you go to high altitudes, it causes hypoxic hypoxia. Okay, so there will be having less ventilation. Okay, guys, is it clear? All different types of hypoxia. Is it clear, guys? I have discussed with you 4 different types of hypoxia. Is it clear? Okay. Okay. Now after this, let's directly jump into our topic. Okay, topic of cellular injury. Now see, the flow chart is going to be something like this. Initially, what happens? Initially, there is injury. First, there is some injury happening. Okay. Now this injury or this stress, right? I should say stress. Now this stress or injury may be mild or it may be severe. For example, right now I am here. Now there is some stress acting on me. Okay, there is some psychological stress, physiological stress, or some mental stress is there. So what I will do in my work environment, if there is stress on me, now first I will try to adjust myself. I will just try to adapt to that stress. So in the same way, whenever you are putting some stress on a cell, now on a cell, the stress can be immunological stress or microbiological stress or toxins, poisons, radiation, okay, antibodies, autoimmune diseases. Now a stress can be of any type. Simple thing is, now you are putting some stress on a cell. Now what that cell will do initially, that cell will try to adapt. So whenever there is stress, a cell will try to undergo adaptation, that is called as cellular adaptation. Okay, so cellular adaptation will happen now, but for everything there is a limit. Now if you increase the stress so much, you are increasing the stress, the cell is adapted but still stress is beyond the adaptation. Now if the stress continues, what will happen? Now cell gives up. Cell will say, I can't take the stress anymore. So what will happen is, initially there will be little injury which is reversible in nature. Little injury is there, but you can reverse it. Okay, so that is reversible cell injury. Okay, so there will be reversible cell injury. Now again stress is continuing and even the stress is increasing. Now cell is no longer be reversed. The injury cannot be reversed. So that will cause irreversible cell injury. Irreversible cell injury. Okay, so this is the flow chart which you should know. First, there is stress. Usually cells will try to adapt to that stress, but if the stress is continuing, initially the cells will undergo reversible cell injury. Later on, cells will undergo irreversible cell injury. Now in this class, let's start with this. Okay, now what is the stress? Now let's talk about the cellular adaptation at the end, but right now first let's concentrate. So what exactly happens in the reversible cell injury, initial injury? What are the changes that you will see in a cell? What kind of morphological changes you will see in a cell? And what happens in irreversible cell injury? Now just tell me, if the cell is damaged, like beyond repair, what will happen? Cell is absolutely damaged. Cell membranes got ruptured, the organelles inside the cell are affected. Now what will happen? At the end of the day, cell should die. So last event is cell death. Okay, at the end of the day, cell gives up. Cell says like, I'm done. Okay, I cannot take the stress anymore. All my cell membranes got damaged, all my organelles got damaged. Now cell will say, no, I'm not going to live further, I'm going to die. So that is cell death. Now again, Here, cell death is of how many types? Cells will die by how many types? It's a simple thing. There are like, see, some, for like, we have different types of people, right? Okay, we have millions and millions of people. Do you think all people will die in the same way? No. Someone will die just by natural aging. Someone will commit suicide. Even the types of suicides are different, right? And someone will be killed by murder or something. Now, in the same way, cell death will also be of different types. Now, see, based on the different cell types, cell death will also be different. Okay, just try to understand it. Now, cell death will happen by different ways. Now, what are the different types of cell death? Necrosis, necrosis, and second type of cell death is apoptosis, and third type is a combination of necrosis and apoptosis, that is called as necroptosis, and last one is pyroptosis. Okay, so these are the 4 different types of cell death which I want you to know. There are even other types, at least you should know these things. Now, from where we should start? We should start with the reversible cell injury. Whenever there is stress, okay, okay, the stress is nothing but the hypoxia. There is no proper availability of the oxygen. Whenever there is no proper availability of the oxygen, stress. Now, cell is under stress. So, what will happen, sir? Now, let's start our topic with reversible cell injury. Okay, guys, is it clear so far? If you have any doubts, you just ask me. Now, our topic we are starting is reversible cell injury. Okay. Okay. Now, let's take what is the most common stress. I have asked to you, what is the most common stress, guys? Hypoxia. Hypoxia is the most common stress. Now, here, just take a minute. Okay, I want you to know a few more points. The most common cause of hypoxia is, I have already explained to you, the most common cause of cell injury is hypoxia, and the most common cause of hypoxia is ischemia. Now, here, just take a small area, just put a note here, note. Now, in your body, there are millions of cells and different types of cells were there. Now, which type of cell is highly sensitive? Okay, which type of cell is highly sensitive to hypoxia? Highly sensitive to hypoxia. Can you tell me? Come on, Nagesh, Bruce. Which type of cell is highly sensitive to hypoxia? The answer is neuron, guys. Okay, see, neurons are going to die. Neurons are going to give up just within 3 minutes. Okay, if you cause hypoxic conditions in your body, your neurons are the first cells to die. Okay, and highly resistant cells, okay, highly resistant to hypoxia means they can withstand the hypoxia for a lot of time. Can you tell me the cell which is resistant to hypoxia? The cell is fibroblast. Fibroblast cells, fibroblasts, your connective tissue. The fibroblasts in the connective tissue are highly resistant to hypoxia. Okay, anyway, come back to our topic. See, right now there is hypoxia happening in your body. Now tell me, now whenever there is hypoxia, can ATP be produced in your cells or not? All your cells, in all your cells, we all know why we are breathing. So we are breathing to supply the oxygen to our cells. Now what this oxygen is actually doing, guys? The oxygen will enter into the cells, into the mitochondria, to the electron transport chain. At the end of the day, the oxygen will be helping in the production of ATP. Without oxygen, there is no ATP. Now, whenever there is hypoxia, whenever there is no oxygen availability, do you think ATP will be produced? No, sir. ATP production cannot happen. ATP is going down. Okay. Now, whenever ATP production goes down, what will happen? Now, ATP is very important. Now, let me show you at least the one important function of this ATP. See, on all our cells, in yesterday's class, in general physiology, we have discussed, on all our cells, there is this ubiquitous protein present. Okay, like it's present everywhere, omnipresent. Now, what is that protein, sir? That protein, which is an example of primary active transport, there is a protein which is present on each and every cell, which will take 2 potassium ions into the cell, which will throw 3 sodium ions out of the cell. Okay, it's throwing 3 sodium ions out of the cell and bringing 2 potassium ions into the cell. So the coupling ratio is 3:2. In yesterday's class, I have explained to you. Now, the name of this pump is called as sodium potassium ATPase. Sodium potassium ATPase. Excellent, guys. Now, my question, ATPase, which means it requires ATP for its function. Now, see, whenever there is no availability of the ATP, whenever ATP is going down, do you think this pump is going to work? This pump is no longer working. Now, when this pump is no longer working, do you think sodium will be kicked out? The sodium is not going out of the cell, sir. Sodium starts to accumulate in the cell. Now, what happens when sodium starts to accumulate inside the cell? So, sodium is osmotically active substance. Okay, wherever there is sodium, water will love to come to that area. Okay, water will come to the area wherever there is sodium. So what happens? Now from outside, water is coming into the cell. Okay, now what happens when water is coming into the cell? That will cause cellular swelling. Okay, cellular swelling. Now my questions, two important questions here which will come in your exam is the first thing, what is the first change that will be seen in cell injury? What is the first change that will be seen in the cell injury? See here, I just want you to know, I just want you to add one more point. See, whenever there is hypoxia, first thing, whenever there is hypoxia means no oxygen. Now which cell organelle will be affected? See, in the entire this cell injury chapter, the one organelle which is highly important and the answer for most of the questions is mitochondria, guys. See, whenever there is hypoxia, the first organelle that will be affected is mitochondria. Okay, mitochondria is the place for ATP production, right? Okay, so no oxygen in the mitochondria, no ATP production. So mitochondria dysfunction. Okay, mitochondria stops its functioning. That is the reason for ATP depletion. ATP depletion. Now, two questions that will that will come in your exam is, what is the first change? First change in cell injury. Your cellular injury in the sense like reversible cell injury. The first change you should all the time answer is the mitochondrial dysfunction. Okay, mitochondrial dysfunction. Mitochondria is not properly working. Why? Because no oxygen. But can you able to see this on histology? Mitochondria is not simply functioning. So you cannot actually see it. It's not morphology, right? You cannot actually see whether the mitochondria is functioning or not. But if they ask you what is the first change, mitochondrial dysfunction. But if they ask you what is the first morphological change, first morphological change means which will be appreciated with your eye, which will be seen on the histopathology. Now what exactly is being changed here? Now cell is increasing in size, that is the cellular swelling. So cellular swelling is the first morphological change which is also called as, can anyone tell me, this cellular swelling is also called as water entering into the cell. So hydro means hydropic change. Okay, so hydropic change. Now, the hydropic change is the first morphological change which is seen in the cellular injury. Okay. Now, after this, what else will happen whenever there is no ATP? Again, same story. This is one side of the story. Whenever there is no ATP, okay, whenever there is no ATP, hydropic change or cellular change will occur. Okay, cellular swelling will occur. Guys, is it clear? Shall I go forward? Now, what are the other changes which you can see with the reversible cell injury? Okay. Now, the other changes include not only the cell. See, water is going into the cell, right? Water is going into the cell. So, the organelles like endoplasmic reticulum, Golgi complex, all these organelles, whatever were there, now they will also start to swell. Okay, they will also start to swell. So, endoplasmic reticulum will start to swell. Okay, endoplasmic reticular swelling. See here, I want you to know this one thing. Normally, if you see, for example, if this is endoplasmic reticulum. Now, on the endoplasmic reticulum, we all know that ribosomes are sitting, right? Ribosomes are attached to the endoplasmic reticulum. Okay, this is called as rough endoplasmic reticulum. So, endoplasmic reticulum and ribosomes, they are just like lovers. Okay, they are very close to each other. See, simply in our community, we are all the time saying, for example, when he is in shape, he is having like good following, like she is also very happy with him. But because of some reason, try to imagine like this. Now this guy is becoming more and more like obese. Okay, now he is becoming more and more obese. Now he is getting out of shape. Now, do you think that girl is going to stay with this guy? Definitely not. In the same way, now here endoplasmic reticulum is now swelling. Okay. Now, whenever endoplasmic reticulum swells, okay, what will happen? Now, ribosomes will detach. Okay. Now, whenever ribosomes are moving away from the endoplasmic reticulum, what will happen? That will cause decrease protein synthesis. So, whenever cell is undergoing reversible cell injury, what I am saying is organelles will swell. Ribosomes are going to be detached from the endoplasmic reticulum, that causes decreased protein synthesis. Okay. Now, next, what else can be seen? What else can be seen? Now, as extra water is coming into the cell, right? Now, extra water is now coming into the cell. Now, what this cell will do? Just see. Now, cell will swell. Now, in order to accommodate the extra water, now this cell, okay, now this cell, now it will protrude like this. It will produce the extra membrane. It's becoming bigger in size. At the end of the day, cell will become something like this. Okay, cell will become something like this. It's producing the extra membrane to accommodate the extra water. So these extra pouchings are called as cellular blebs. Okay, cellular blebs are cytoplasmic blebs. So cytoplasmic blebs are seen in reversible cell injury. Endoplasmic reticulum swelling, reversible cell injury. Hydropic change, reversible cell injury. Now at the end of the day, do you know what exactly happens? Now this cell membrane is being stretched. Cytoplasmic blebs are forming. Now this cytoplasmic blebs, this is all happening with the cell membrane, right? Now at some point, at certain particular areas, what will happen? Cell membrane will undergo damage. Means the cell membrane which is made up of phospholipids. In yesterday's class we have studied cell membrane made up of phospholipid bilayer. Now this cell membrane will somewhere get damaged, and the small cell membrane pieces, now they will fall back into the cytoplasm. Now they will start to curl like this. Okay, now they will start to curl like this. Now what exactly are these, guys? Can you tell me what exactly are these? These are called as myelin figures. Myelin, just give me 1 minute. Myelin figures. So in your exam, the question that will come is, so these myelin figures are exactly made up of. These myelin figures are made up of, can you tell me? I have explained to you the myelin figures which are seen in reversible cell injury. Mainly they are seen in reversible cell injury, but they can also be seen in irreversible cell injury. Later we will discuss. Myelin figures are made up of phospholipids. Okay, myelin figures are made up of phospholipids, also little amount of calcium. Okay, so direct question, myelin figures seen in reversible cell injury or irreversible cell injury? Seen in both. Okay, seen in both. And these myelin figures are made up of what? These are made up of phospholipids as well as little amount of calcium. Okay, and it's done. Okay, let me show you even image. Like the image based question is important. Okay, let me show you the image. See here. See here, myelin figures. I think here you can clearly see. See, this is a cell which is undergoing a reversible cell injury, where you can see a myelin figure. Okay, myelin figure means the whorls of this phospholipid. Phospholipid is now like just like a whorl. Okay, so this is an image based question, electron microscopic image, where you can see a myelin figure. Okay, now let's go forward. Now what else will happen whenever there is decreased ATP? Now whenever there is decreased ATP in the cell, okay, whenever there is no oxygen, ATP is going down. Okay, now mitochondria are being affected. Normally, my question for you is, which type of respiration will happen in our body? Normally, whenever there is availability of oxygen, there will be oxidative phosphorylation or aerobic glycolysis. Aerobic glycolysis is happening in your body and my body. But whenever there is no availability of oxygen, that is hypoxia, no availability of oxygen, now what happens? Now our body is going to shift into anaerobic glycolysis. Okay, anaerobic glycolysis. Now whenever anaerobic glycolysis happens, the end product in biochemistry you would have studied what is the end product of anaerobic glycolysis. The end product of anaerobic glycolysis is lactic acid. Okay, the lactic acid. Now in our body, whenever there is hypoxia, our cells will produce lactic acid. Guys, this is acid or not? Definitely acid. Now whenever there is acid inside a cell, it will cause decreased pH or increased pH? It will cause decrease in the pH. Now whenever pH decreases, okay, whenever pH decreases, now what changes will be seen in the cell? In a reversible cell injury, what changes will be seen? You will have chromatin clumping. Okay, chromatin. See, inside the nucleus, we are all having this chromatin, right? Whenever chromatin condenses, it forms a chromosome. Now there will be clumping of chromatin. Okay, clumping of chromatin. So MCQ that will come to you in your exam is, what is the nuclear change? What is the nuclear change that will be seen in a reversible cell injury? It is clumping of chromatin. Why there is clumping of chromatin? It's because of the anaerobic glycolysis which causes production of the lactic acid, which decreases the pH. So such decrease in pH, such decrease in this environment in a cell will cause the clumping of chromatin. Okay. Now, so right now what we have seen the reversible cellular injury. So far, see, so far there is stress, but if you can reverse, okay, if you can take out the stress, again if you give back the oxygen normally, now what will happen? The cell will become absolutely normal. Now, till now, the cell will become absolutely normal. This clumping of chromatin is reversible, cellular swelling is reversible, okay, everything will be reversible so far. Okay, mitochondrial dysfunction will be reversible, everything will be reversible. Now what happens is, for example, whenever you just you are not giving any treatment, if you just let the cells like that, now what will happen is this reversible cell injury will convert into irreversible cell injury. Important. Reversible cell injury will be converted into irreversible cell injury. Okay. Now, important points is, sir, when can we say that the cell is no longer repaired? Now, what is that particular event? For example, if this happens, that's it. It's irreversible cell injury. Cell will no longer be repaired. Can you tell such events? See, first what is happening? Stress. Reversible cell injury. Now, reversible cell injury, reversible cell injury, reversible cell injury. But whenever cell membrane damages, okay, whenever there is severe damage in cell membrane, okay, see, let's take whenever there is severe damage in cell membrane, okay, and severe damage to mitochondria, okay, and severe damage to severe damage to nucleus. Okay, not just clumping of chromatin, severe damage to nucleus like pycnosis, karyorrhexis. Now cell is no longer repaired. Now cell will go into irreversible cell injury, sir. So what are the events which will determine reversible cell injury and irreversible cell injury? So cell membrane damage. Repeatedly ask MCQ. When cell membrane is damaged, that's it, irreversible cell injury. Severe mitochondrial damage, irreversible cell injury. Severe nuclear damage, irreversible cell injury. Okay. Now what will happen later? See, now there is severe damage to cell membrane. Whenever there is severe damage to cell membrane, now whenever there is severe damage to cell membrane, now cell membrane is damaged, right? Okay, cell membrane is damaged. now there will be inflow of lot of ions into the cell, inflow of lot of substances into the cell. For example, see, I am showing you a cell like this where cell membrane is damaged. Okay, that is the reason why I am showing you all these gaps. Now what will happen from outside the cell? Substances especially like calcium, okay, calcium is going to enter into the cell. Remember, for your entire life, the calcium concentration inside the cell is very less. Calcium concentration inside the cell is less, calcium concentration outside the cell is more. If they specifically ask you the calcium concentration in the cell, inside the cell, is more in which area? In endoplasmic reticulum. So even inside the cell there is an organelle called as endoplasmic reticulum, ER, or sarcoplasmic reticulum. All the calcium is stored here. Calcium is stored here. Usually calcium is not available in the cytoplasm. Okay, that's a totally different thing. That's a total physiology. Right now what I'm saying, membrane is damaged, sir. Membrane is damaged. Now calcium is now coming into the cell. Now what this calcium will do? That's the question. Now this calcium will bind with the enzymes. Okay, now inside your cytoplasm there are a lot of enzymes, right? Like proteases, nucleases, lots of destructive enzymes are there. Remember, calcium is activator of enzymes. So unnecessarily now what is happening, calcium is being brought into the cell. Now this calcium will activate proteases, endonucleases. Now this proteases, endonucleases will cause destruction of the proteins inside the cell, destruction of the nuclear material inside the cell, so that cell will undergo death, cell death. Okay, now that's a totally different story. But right now the point which I want you to know is, sir, this calcium, it's coming into the cytoplasm, and where it will go? Especially it goes into an organelle called as, now you have to tell me what is this organelle, sir. So there is an organelle which is having double layers. Okay, it is having two cell membranes, dual layered. Now it is also called as a powerhouse of cell which produces the ATP. This calcium is coming into the cytoplasm. All these calcium molecules, do you know what these calcium molecules will do? Now those calcium molecules will go and settle in the mitochondria. Now all these events are happening in reversible cell injury or irreversible cell injury? Sir, cell membrane is damaged, so we are not talking about reversible. Right now we are discussing about irreversible cell injury. Okay, now in this irreversible cell injury, all the calcium is being brought into the mitochondria, and this if you see under the electron microscope, this mitochondria with calcium inside it, it will look like a large amorphous body. So large amorphous flocculent densities. Okay, large flocculent amorphous densities, they are the hallmark. Okay, they are the hallmark. Okay, they are the hallmark of irreversible cell injury. Okay, they are the hallmark of irreversible cell injury. My point is, large amorphous flocculent densities are seen in mitochondria. The first cell organelle that will be affected in cell injury is mitochondria. Okay, large amorphous flocculent densities are nothing but calcium deposition inside the mitochondria, which is seen in reversible cell injury. Okay, now after this, okay, now let's see what else will be changing in reversible in irreversible cell injury. Right now we are discussing about irreversible cell injury. Right now I have just discussed with you, there are large amorphous flocculent densities which are the hallmark of irreversible cell injury. Now what are the nuclear changes which you will see? Nuclear changes. Okay, whenever the nucleus is damaged beyond repair, now what will happen? Now the nucleus is now becoming smaller and smaller and smaller in size. Now this condensation of the nucleus becoming small, right? Now this process is called as pycnosis. Okay, pycnosis, that is condensation or shrinking. Okay, condensation or shrinking of the nucleus. So pycnosis, later on, now nucleus is becoming smaller, 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 smaller. There will be a time, now this nucleus, see, nucleus is becoming smaller in size. Now this nucleus will be like, destroyed into small pieces. Now this is called as karyocytosis. Caryorexis. Okay, caryorexis. Now, what exactly is caryorexis? Caryorexis means fragmentation of nucleus. Okay, nucleus is being like destroyed into small pieces. So, fragmentation. Later on, what will happen? Caryorexis is followed by karyolysis. Okay, karyolysis. Now, what exactly is karyolysis? Lysis means dissolution. Okay, karyolysis means dissolution. Entire nuclear material is dissolved. So these are the nuclear changes. Nucleus will become initially the nucleus will become smaller. That's karyorexis, followed by first is pycnosis, karyorexis, and karyolysis. These are the nuclear events which will happen, guys. Okay. Now, so irreversible cell injury, the events which will happen in the irreversible cell injury, we have also discussed. The straightforward. First, stress. Whenever there is stress, cells will try to adapt. We haven't discussed about the cellular adaptations. Cellular adaptations we'll discuss in the next class. That's something like hypertrophy, hyperplasia, metaplasia, like something like that. Okay. First, initially stress, cells will try to adapt. Now, if the stress continues, initially there will be reversible cell injury. The stress continues, reversible cell injury will continue into irreversible cell injury. Okay. Now, at the end of the day, what should happen? Death should happen. So, that is last event which will happen is the cell death. Cell death. Okay. So, how many types of cell death I have discussed with you? So, there are different types of cell death. Like, first type is necrosis, apoptosis, necroptosis, pyroptosis. Okay. Now, let's start our discussion with necrosis. Okay, our first discussion is a necrosis. Okay. Now, simple. Remember something like this. Necrosis. Repeatedly ask MCQ. Necrosis is always pathological. This is the MCQ that will come up in your exam. Always pathological means what does I mean by? First of all, if I say necrosis, apoptosis, pyroptosis, necroptosis, what is the common thing? Common thing in every type is death. Death of a cell. So in necrosis also, death is happening. Cell is dying. Here cell is dying because of some pathology, never physiological. There are sometimes where cell should have to die. Okay, even physiologically, we will discuss. But necrosis is something like a murder. Imagine, take necrosis like a murder. Murder is all the time pathological, right? I don't want to die, but if some person comes and kills me, now what can I do? So like that, so necrosis is always pathological. Cell don't want to die, but because of some other external influence, because of some infection or because of some immunological mediated thing, cell is dying. So necrosis is always pathological. Okay. Now comes the question, how many types of necrosis is there? Necrosis is one type? No. Necrosis is a type of cell death which includes different types. For example, necrosis include the main types which I will be discussing to you is coagulative necrosis. Second type is liquefactive necrosis, fat necrosis. Okay. Next is gaseous necrosis and fibrinoid necrosis. Okay. So these are the different types of necrosis. Now I have already explained to you. See, necrosis is something like a murder. Now you don't want to die. I just don't want to die. But if some person comes and kills me, what can I do? So how many ways a particular person can come and kill me? See, he can simply come with a knife, he can stab me, I will die. Or he can put a bomb behind me, I will die. Or he can just give some poison to me, I will die. So there are different ways. Like, a cell can be killed. There are different types of cells in our body. So different types of cells will die in different types of necrosis based on the composition of the cell. Cells will die differently. For example, most of the cells in our body, most of the organs, most of the tissues, whenever you stress them, whenever you give pathological stress to them, they will die, right? They will die. First, Adaptation, irreversible cell injury, first stress, cellular adaptation, reversible cell injury, irreversible cell injury, later death. So most of our body tissues will die by coagulative necrosis. Okay, will die by coagulative necrosis. Let's start with the coagulative necrosis, guys. What is the most common type of necrosis? Coagulative necrosis. Coagulative necrosis is most common type of necrosis. Now, what exactly is happening in the coagulative necrosis? So, cells are dying, tissue is dying. Okay, tissue is dead. For example, right now I have myocardial infarction. Okay, hope I won't have. But because of some reason, if I have myocardial infarction, cells are dying in my heart, right? Okay, cells are dying in my heart. For example, because of severe renal artery stenosis, or because of the ischemia to spleen, they will die, right? Cells will die, right? But after the death, if you look at the architecture of the cells, if you look at the morphology of the cells, still you can recognize, okay, these are the myocytes. Okay, the architecture of the cells is absolutely preserved. Okay, the cell architecture. Okay, cell is dead, no doubt, but you can find the architecture. Okay, this is a myocardial cell, this is a kidney cell, something like that. So architecture is preserved. Okay, now what is the mechanism which is happening in the coagulative necrosis? So coagulation. Okay, coagulation, name itself. See, coagulation means a denaturation. What exactly is happening here in coagulative necrosis? When the cell is dying, all the proteins in the cells are getting denatured. So very, very important, denaturation. Denaturation of proteins. Okay, denaturation of proteins happens in which type of necrosis? Coagulative necrosis. In which type of necrosis? Cell architecture is preserved? Coagulative necrosis. What is the most common type of necrosis? Coagulative necrosis. Okay. Now all the cells are dead. Okay, all the cells are dead. If you look at under the microscopy, we are not pathologists, right? We are doctors. Now you have to know certain important points to cross your exams. Just know these points. Now if you look under the microscopy, it will give you a morphological appearance that they are all the cells, they are dead and they are arranged in a row. They are not just liquefied, they are still there. The cell, like the cell membranes, everything is still there. So they just looks like a row of, okay, row of tombstones, a row of tombstone appearance. So row of tombstone appearance is seen in coagulative necrosis. And these cells, whenever you see these cells, for example, this is a cell. Normally, cells will have a nucleus inside it. Okay, I should actually draw it with the blue color. Okay, why? Because nucleus will be taking the blue color. So this is how a normal cell looks like. Now here, cell is dead. So do you think nucleus is there? No. In the irreversible stage itself, there is pycnosis, karyolysis, and karyolysis. Nucleus is gone. Now see, now what happens when a cell is dead? Cell architecture is preserved, but nothing is there inside the cell. So such type of cells are called as ghost cells. So now questions. Ghost cells are seen in coagulative necrosis. Denaturation of proteins, coagulative necrosis. Row of tombstone appearance, coagulative necrosis. Architecture preserved, coagulative necrosis. Most common type of necrosis is coagulative necrosis. At the end of the day, what they will ask you is image based question. Okay, usually the coagulative necrosis is because of hypoxia, due to because of ischemia. See, usually most of the time, for example, here you can clear cut see. See, here will be the blood vessel. Actually, the blood vessel here is something like this. Try to understand it. This is a piece of kidney. Now, there might be some reason this blood vessel got blocked. This blood vessel, like which is actually perfusing all this area got blocked. Stenosis is there. Now, what happened? All this area there is no blood flow. Ischemia is there that causes hypoxia. So all this area, what's happening? Cell death is happening. It's looking like a wedge, right? Wedge. Okay. So wedge shape. Usually coagulative necrosis happens in a wedge shape. Okay. So they will give you this image based question. This is a kidney. Okay, kidney piece, right? What is the type of necrosis here? It's a coagulative necrosis. Okay, wedge shape. And here also you can clearly see it's a wedge shape. This is a piece of spleen. Okay, because of some reason the blood vessel got blocked, so all this area which is yes, perfused by that blood vessel got blocked and it is undergoing coagulative necrosis. So is it clear, guys? I have dealt with coagulative necrosis. Now after coagulative necrosis, I want you to know the second type of necrosis, which is called as liquefactive necrosis. Liquefactive necrosis. Okay, so this is absolutely different story. Okay, these guys will die in a different way, that at the end of the day, whenever you look at the architecture of the cells under the microscopy, you cannot find whether it's a heart tissue, you cannot find it's a myocardial cell or is it some kind of a nephron. Nothing is visible, like everything is liquefied. So that is called as liquefactive necrosis. Necrosis, cell death is happening, cell is dead, no doubt, but architecture is not preserved. Architecture architecture of cells not preserved. Okay, architecture of cells is not preserved. And question is, this type of liquefactive necrosis is going to happen in which organs? Those organs which are having high enzymes inside them. Okay, those organs which are having high enzymes. Okay, highly enzymatically active tissues, high enzymes. For example, like brain and pancreas. Okay, brain, pancreas, and even once a question was asked, abscess. Okay, brain abscess is like nothing but like an infection, right? See, if they ask you in brain, if the brain cells, for example, because of some reason, okay, there is hypoxia, neurons are dead. Now, these neurons are dying by which type of necrosis? Neurons are undergoing necrosis, pathological, absolutely pathological. If you don't give oxygen, hypoxia. Hypoxia is definitely pathological, right? So neurons are dying. Now, this death is necrosis. So which type of necrosis? Now, neurons are having high lipid content, and these neurons are having high enzymes. Now, whenever there are these acidic enzymes or hydrolytic enzymes present, that hydrolytic enzymes during the death of the cell will take out all the architecture. Everything is going to be dissolved. So that causes liquefactive necrosis. So brain and pancreas will undergo liquefactive necrosis. Very, very important. Okay, like they will ask you in acute pancreatitis. Acute pancreatitis. We all know pancreas have lots of exocrine glands like pancreatic amylase, pancreatic lipase, colipase, procarboxypeptidase, like all these enzymes, like trypsinogen, chemotrypsinogen. It's a highly active in enzymes, right? Whenever there is acute pancreatitis, inflammation, enzymes will be leaking into the tissue. All those enzymes will digest the pancreas, causing liquefactive necrosis. Okay, here the stress is inflammation. Okay, done. Now, after this, um, I should tell you this liquefactive necrosis is also called as qualificative necrosis. Okay, qualificative necrosis. Now, see here the image based question. Now, if they show you the brain something like this, here you can clearly see the liquefactive necrosis of brain. Okay, in the brain there is this area which is undergoing liquefactive necrosis. If you take a tissue from here, if you put it under the microscope, nothing is nothing is going to be properly visible. Like it's like totally messy. Okay, mash up. Now, after liquefactive necrosis, the third type of necrosis which I want you to know is gaseous necrosis. Okay, guys, so far everything is clear. Guys, gaseous, gaseous necrosis. Okay, now, so what exactly is gaseous necrosis and in which conditions you will see this gaseous necrosis? Guys, this gaseous necrosis especially seen in lungs in cases like TB. Okay, in cases like TB and in cases like histoplasmosis. All these are the fungal infection, right? So TB, Mycobacterium TB, and conditions like histoplasmosis and coccidioidomycosis. All these fungal infections, whenever infection happens to the lung, infection is a stress here. Now, whenever such kind of infection happens to the lung, now these lung tissues will also die. Now here, these lung tissues, will they, after the death, will they have coagulative necrosis or will they have liquefactive necrosis? It means a combination. Okay, combination of gaseous necrosis is actually a combination of coagulative coagulative plus liquefactive necrosis. It's a combination of both liquefactive as well as coagulative necrosis. But most commonly it is coagulative necrosis only. Now, what exactly do we mean by caseous necrosis? Caseous material means cheesy material, cottage cheese like. Cottage cheese like. At the end of the necrosis, at the end of the cell death, if you look the morphology, if you look at the morphology of the tissues, it will just look like a paneer kind of appearance, or just look like a cottage cheese, cheesy thing. Let me show you here in the image. See, here I am showing you a lung. Here you can see this caseous or cheesy material. It just look like a cheese kind of material, waxy material. Okay, waxy material. So this type of necrosis is called as a caseous necrosis, and this caseous necrosis is due to a high lipid content. Let me write it here. It's because of the high lipid content. Okay, it's a cheesy, right? It's because of the high lipid content in the microorganism. Okay, especially in Mycobacterium TB. Now in Mycobacterium TB, this is growing, right? This is growing inside the lung. It's causing the necrosis. It's causing the caseous necrosis over there. Now these organisms are also multiplying definitely. Now if you look at the cell wall of TB, okay, cell wall of TB. Now in the cell wall of TB, we all know there is something called as mycolic acid. Mycolic acid. Now this mycolic acid is the one responsible for the acid fastness of this organism. We all know from our basics. Mycobacterium TB, is it gram positive or gram negative? No, it's not gram positive, it's not gram negative. It's actually acid fast in nature. That acid fastness is because of something called as a mycolic acid in its cell wall. And this because this mycolic acid is having high lipid content. Because of this high lipid content there over this area, because of this organism, it looks like a it look more waxy or cheesy in nature. Now next, the other type of necrosis is fat necrosis. Fat necrosis. Now, wherever there is fat, if the if the adipocytes are being damaged, okay, if the adipocytes, if they are dying, they will undergo fat necrosis. Very simple. For example, in your body, your abdomen is there, right? Your abdomen will be having these big bellies. Now, this big bellies is because of the presence of the adipocytes here. You are having momentum, greater momentum is there, and that greater momentum is having lots and lots of adipocytes. Fat is there, and the buttocks fat is there. In females, breast tissue, it's made up of absolutely fat. So wherever you have fat in your body, for example, if there is some trauma, okay, if there is some trauma, now that trauma will cause, trauma is the stress here, the trauma will cause the death of these adipocytes. Now these adipocytes, they will die in a different way. They are like, they will say like, we are special, we just don't want to go like coagulative necrosis, liquefactive necrosis or caseous necrosis. We just want to have our own special type of necrosis, that is fat necrosis. So fat necrosis happens in fat rich areas due to trauma. Fat rich areas are getting necrosed, okay, due to trauma. Okay, due to trauma. Now, like examples I can give you, like uh, in acute pancreatitis, there will be fat necrosis. Now you will get it out. So you just said us, in pancreas, liquefactive necrosis is the one supposed to happen, right? In pancreas and in brain, liquefactive necrosis is the one which is supposed to happen. But guys, just see. Now let me show you. Okay, let's take it as a pancreas. Okay, now we all know pancreas is surrounded by what? Pancreas, your kidneys. Now pancreas is something surrounded by the peripancreatic fat. Even fat is present around the pancreas. Now our condition is acute pancreatitis. Whenever there is acute pancreatitis, all the enzymes are now acting. Okay, all these enzymes are now leaking and they are acting on the peripancreatic fat. Now these enzymes will digest away the fats. Now these fat molecules, the adipocytes, now they are dying. So causes fat necrosis. Now something important here for your exam is, whenever there is fat necrosis, what happens? All these fats are being totally destroyed. Okay, adipocytes are being killed. Now it releases the fatty acids. Fatty acids. Okay, fatty acids are being released. Now important point is, The fatty acids will love to bind with the calcium ions. Fatty acids love to bind with the calcium ions. This process is called as saponification. Now, at the end of the day, what you will see here is the presence of the white dots. Okay, let me show you with the small. See, actually, in the pancreatic peripancreatic fat, you can actually see these white depositions, small white depositions. These are nothing but, okay, the calcium depositions. Calcium is being deposited along with the fatty acids. Okay, this will give you chalky white appearance. CHALKY, a chalky white deposits. So direct question, chalky white deposits are seen in which type of necrosis? Fat necrosis. These chalky white deposits are nothing but the calcium is now getting deposited along with the fatty acids. This process is called as saponification. Now, here I just want you to know one more important point. Whenever the calcium is getting deposited in one area, that is called as calcification, right? Calcification. Here also calcification is happening. Now in pathology, there are two types of calcification. One is metastatic calcification. The other type is dystrophic calcification. Metastatic calcification, dystrophic calcification. Remember, okay? Now here calcification is happening. Is it an example of dystrophic calcification or metastatic calcification? MCQ. See, here in this condition, the blood levels of calcium is absolutely normal. Okay. So here what is happening, because of some destruction, over here, calcium is coming and being deposited here. So cell death is there, calcium are coming and getting deposited. This is an example of dystrophic calcification. Okay, now you will get it out. So then what exactly is metastatic calcification? For example, right now you just take an injection, calcium injection, and you just pump the calcium ions into my body. So what happens? The amount of calcium in my blood is increased. So I'm having hypercalcemia. So whenever my blood levels of calcium increases, then all this extra calcium will love to go and deposit in different areas in my body. So blood calcium levels are increased. That is the reason why this calcium is being precipitated in different areas, like in the kidneys, forming kidney stones. So kidney stones, it's some kind of an example of metastatic calcification. In metastatic calcification, blood calcium level increases and calcium is being deposited. In dystrophic calcification, see, in the dead tissues, if calcium is coming and being deposited, that's an example of dystrophic calcification. Okay, so here chalky white deposits are seen in, just direct question, chalky white deposits are seen in which type of necrosis? Fat necrosis. Now, two questions which you should never ever forget, I will give you. Okay, acute pancreatitis. If they ask you directly acute pancreatitis, the answer is liquefactive necrosis. If they ask you acute pancreatitis is happening, but what about the peripancreatic fat? Peripancreatic fat, the fat necrosis. Okay, so fat necrosis is something happening in the breast, omentum, buttocks, okay, peripancreatic area, all these things. Okay, let me show you the image based question. See, you can clearly see this is the omentum. Okay, omentum, in which you can see this white deposits. Okay, all this area you can see the white deposit. These white deposits are nothing but, like, calcium depositions. Okay, chalky white deposits, example of a dystrophic calcification. And also you can see here this is a pancreas. Okay, pancreas. Now even in pancreas you can clearly see, okay, this white color areas. Okay, white color areas, which is nothing but the calcium deposition. Okay, now at the end of the day, the last type of fibrosis which I want you to know is fibrinoid necrosis. Okay, fibrinoid necrosis. So this fibrinoid necrosis is because of the deposition of immune complexes. So what exactly are these immune complexes? You will get it out. So what exactly is this immune complex? Immune complex is nothing but antigen along with the antibody. So antigen is bound with the, see, this is an antigen which is bound along with an antibody, is called as an immune complex. Now antigens, antibodies, where they are present? They are present in the blood vessel. Now, whenever these antigens, antibodies, whenever these are abnormal things, right? These complexes are abnormal things. Whenever they are traveling inside a blood vessel, they will deposit inside the blood vessel, within the wall of the blood vessel. They will trigger the inflammation. They will cause the death of the blood vessel. So, whenever I hear about the fibrinoid necrosis, all the time, the structure that will come in my brain is the blood vessels. Okay, so the blood vessels are going to be like undergoing death. Okay, the wall of the blood vessels is undergoing death by a process of fibrinoid necrosis. If you ask me the examples of fibrinoid necrosis, polyarthritis nodosa, pan. In the condition of polyarteritis means, poly means many, arteritis means arteries, blood vessels. Polyarthritis nodosa is an example. And rheumatic heart disease. So rheumatic heart disease. In rheumatic heart disease, repeatedly ask the question. In rheumatic heart disease, you are having a characteristic pathological hallmark bodies are there. Okay, whenever if I am the person who is suffering with a disease called as a rheumatic heart disease because of group A beta hemolytic streptococcus, that will cause rheumatic heart disease. Okay, my question is, if I am having rheumatic heart disease in my in my myocardium, if you cut my myocardium and if you look, you will see certain bodies. Okay, where fibrinoid necrosis is happening. There is an area of fibrinoid necrosis with lot of macrophages and all the stuff. Okay, now these bodies are called as anyone? Anyone? Yes, excellent, Bruce. Ashoff nodule. Now, the direct question which will come in your exam is Ashoff nodule is an example of fat necrosis, fibrinoid necrosis, caseous necrosis, coagulative necrosis, liquefacture necrosis. The Ashoff nodule is an example of fibrinoid necrosis. Okay, and Ashoff nodules also, remember, just for now, Ashoff nodules are pathognomic feature of rheumatic heart disease. Okay, now we are done with the fibrinoid necrosis also. Let me show you the image of fibrinoid necrosis here. Okay, actually I forgot to place the image. Okay, anyway, okay, I just forgot to place the image. I will show you in the later class. Now after this, see, we have completed all the types of necrosis. All types of necrosis are completed. Necrosis is always pathological, don't forget. Now what is the other type of cell death? The second type of cell death is the apoptosis. Okay, now we have to discuss about the apoptosis. Guys, shall we take a break of 5 minutes? Not even 5 minutes, just 3-4 minutes. Shall we take a break of 3-4 minutes and let's continue with the important points in the apoptosis? The intrinsic pathway of apoptosis, extrinsic pathway, caspases, initiator caspases, executionary caspases. After that, how cell dies. Okay, how cell is going to be died in a programmed way. Let's take a small break of 3-4 minutes and let's come back and discuss about the pathways of apoptosis. Okay, if you have any doubt, you just put it in the chat box. Yeah, you can all the time have this recording in the YouTube. We are not going to remove the recording. It will be all the time available in the YouTube. Atherosclerotic plaque calcification is also an example of dystrophic calcification, not metastatic calcification. Okay, break. Okay guys, let's come back. We have already discussed about the necrosis. Now let's continue about the apoptosis. Now, the first difference between necrosis and apoptosis. See, necrosis is just like a murder. Okay, you no need to do anything. Someone will outside will come and kill you. You don't need to do anything. There is no programming. There is no need of any energy by yourself. Okay, you are dying. The cell is dying, but you don't need to use any energy. Someone from outside is coming and killing you. So necrosis is passive. Remember, all the time. Remember, necrosis is something passive. Okay, before that, one thing which I have just forgot to show you before. See here, which type of necrosis is happening, guys? Just look at this is a blood vessel. This is the wall of the blood vessel. Now, if I am talking about the wall of the blood vessels, which type of necrosis will happen due to the deposition of immune complexes? Fibrinoid necrosis. Guys, are you able to appreciate here this red color area, the pink color area? So this is like a fibrin as a deposition, right? Actually, here what happened is fibrinoid necrosis. And what I'm saying, all the type of necrosis, doesn't matter whether it is coagulative necrosis, like liquefacture necrosis, fat necrosis, or caseous necrosis, doesn't matter. Necrosis is always passive. It's always passive, and it's always pathological. Pathological. Right now, what I'm discussing is apoptosis. Okay, apoptosis is self-destruction. Okay, it's a programmed cell death. A programmed cell death. Okay, there is a program for even the death of the cell. Now cell is deciding, okay, this is how I should die. Okay, this event should happen, later on this events, later on this events. Now cell is just like committing like a suicide. So necrosis is like a murder, but apoptosis is like a committing suicide. No one is doing anything from outside, but cell itself, sometimes physiologically certain cells need to die in your body. For example, think like this. Now, whenever during embryogenesis, the classical example which will keep on coming in your exam. See, this is how your the hand will be. Your hand will be something like this, like a stump. Now, do you know what will happen? A certain cells by themselves they will undergo apoptosis. Okay, usually your hand is not having all these fingers. Okay, all these digits are not there. Okay, now what happen is, now certain cells in between they will undergo apoptosis, they will die. Now whenever they die, what will happen? Gaps will form. Now that gaps are the ones responsible, you are having all these digits. Okay, now all these gaps are because of the apoptosis. Okay, this is something absolutely physiological. Now what is a physiological example of apoptosis? Embryogenesis. Okay, apoptosis is a programmed cell death. It is physiological or pathological. See, you should never ever forget it is physiological. Physiological as well as pathological. Sometimes, okay, pathological. Okay, even pathological apoptosis can happen. So physiological as well as pathological, but necrosis is all the time pathological. Now, other thing, apoptosis. It's a program, right? It's a program. Cell is committing suicide. Now it uses ATP, it uses energy. So apoptosis is AP, apoptosis is active process. Active process. No doubt, it's an example of active process. Now examples are very, very important. What are the examples? Okay, especially physiological examples. Physiological, sir, you are saying apoptosis, cell death should happen physiological in your body during certain times. What are they? First example is during embryogenesis. Okay, during embryogenesis, lot of cells, unnecessary cells, they will die. Okay, now especially see, we know that the thymus which is present, the thymus gland which is present in the mediastinum, it will be of a bigger size whenever you are an infant and during adulthood. It's of a bigger size. It's actually bigger in size. But whenever you are moving towards your older ages, what will happen? The thymus cells, like the thymic size is going to be like getting smaller and smaller. So this is called as the involution of thymus. This is something physiological. It happens in your body and my body. The thymus which is like bigger in size, the thymus gland, Now it's becoming smaller and smaller and smaller. Is it pathological? No. With age, it becomes smaller. This is absolutely what's happening. Some cells are dying. Some cells are dying, and this is absolutely physiological. So, involution of thymus. Involution of thymus is an example of physiological example of apoptosis. And other thing, for example, in my body, do I have WBC or not? Yes, I do have WBC. Okay, like B cells and T cells are there. Now these B cells and T cells, they should be self-reactive or they should attack the foreign antigens. They should have to attack the foreign bodies, right? It should not attack my, my own body. See, B cells, they are produced in the bone marrow, and T cells, they are also produced in the bone marrow. They will undergo maturation, right? There is something like education process. The B cells mature in bone marrow, T cells mature in thymus. The education process will happen. So that what exactly is happening during that maturation? They are trained in such a way. B cells and T cells, they are trained in such a way. Now they will only recognize and attack the foreign antigens, not the self antigens. For example, do you think, for example, in your university, if 100 students are studying, all of them will graduate? No, definitely not, right? So even during this maturation process, for example, if there is a B lymphocyte, imagine that there is this B lymphocyte which is self-reactive. It is attacking our own body cells. Do we need such kind of B lymphocytes? No. Every day in our body, such self-reactive B lymphocytes are being being produced. Such self-reactive T lymphocytes are there in our body, but those cells need to be immediately cleared. Those cells need to be taken out. So those self-reactive lymphocytes will automatically program to cell death. So apoptosis of self-reactive lymphocytes is an example of physiological apoptosis. Okay, see, they have to die, right? They have to die. Otherwise, we'll be in problem. Okay, we'll get autoimmune disorders. And what else you should know regarding this apoptosis? The fourth important point is it's a programmed cell death. Certain enzymes are helping in the cell death. Okay, there are certain particular enzymes, a group of enzymes called as caspases. Okay, caspases, C-A-S-P-A-S-E-S, caspases. Okay, caspase mediated. Cascade mediates apoptosis. Now, if you ask me, sir, what exactly is this caspase? Very, very important, guys. Now, this caspase, see, CA is there, right? Okay, see, what exactly is the C refers to? C. Okay, cysteine. Okay, so caspases are nothing but cysteine. This enzyme caspase, it's made up of which amino acid? Cysteine amino acid. So what it will do? See, first of all, caspase. Ase means ase means enzyme. Enzyme made up of cysteine. What it is doing? It causes it causes breakage of anything at the aspartate residues. For example, see, caspases are actually protein breakdown things. Okay, now for example, imagine here is the here is a protein. Okay, here is a protein. Now this protein is made up of amino acids, right? Like aspartate is there, right? So for example, here is an aspartate, here is an aspartate, here is an aspartate residue. Okay, now what this caspase will do? This caspase will come, it will look where is the aspartate residue, and wherever there is an aspartate residue, it's going to cleave there, it's going to break there, it's going to break. So that proteins are going going to undergo destruction, denaturation is going. Proteins are going denaturation. So what I'm saying, this apoptosis is physiological as well as pathological. It is a programmed cell death. It is an active process, and it is caspase mediated. Caspase mediated. Okay. Now, here after saying this, uh, so we have discussed the physiological examples of apoptosis. Physiological examples. Can you give us some pathological examples of apoptosis? Pathologically, see, very very important. Physiological examples I gave three. The three physiological examples are embryogenesis, elimination of self-reactive lymphocytes, and involution of thymus. These are the three examples. Now I will give you pathological examples of apoptosis. So, logical apoptosis. Repeatedly asked MCQ. So, two, especially the one at least you should know is Councilman bodies. Okay, the Councilman bodies are which seen in hepatitis infection. Okay, hepatitis infection, especially hepatitis C infection. See, hepatitis C is a virus. Okay, hepatitis C is a virus. Now, what will this virus do? Now, this virus will enter into hepatocyte. Now, this virus is entering into hepatocyte. Now, this is a hepatocyte inside which you are having a virus. This is a virus. Now, what this virus is doing inside an hepatocyte? Now, this virus is using the hepatocyte as a host and it is multiplying. It's multiplying. Now, this hepatocyte knows, oh my God, there is a bad fellow inside me. Okay, it's just like, it's like, coming into the hepatocyte, it is dividing. Now, this hepatocyte decides there is some mass replication of this hepatitis C is happening inside. This is not good. If it's not doing anything, what will happen at the end of the day? Lots and lots of viral replication will happen. All these viruses will damage this hepatocyte and release of this virus will attack the nearby hepatocytes and they will also be affected. So do you know now what will happen? Now this hepatocyte is committed, it is decided. Now I won't let this hepatitis C virus to multiply inside me. Further, do you know what it is doing? It is committing suicide. This hepatocyte, it will die. It will commit suicide. So, this hepatocyte is now being programmed in such a way, it will undergo apoptosis. Okay. Now, this is a pathological example of apoptosis. Now, this dying hepatocyte is called as Councilman body. So, this dying hepatocyte is called as Councilman body. Okay. Now directly tell me Councilman bodies are seen in which infection? Hepatitis infection. Okay, guys, is it clear? Shall I go forward? Okay. Now, see here, let me divide apoptosis into steps. What are the two important steps of apoptosis? Apoptosis is mainly divided into two steps, guys. First, you have to initiate the process. Okay, initiation. Apoptosis is mainly divided into two events: initiation and execution. Execution means final state, execution. Okay. Now, initiation as well as execution. So, initiation should have to start either from outside or from inside. For example, initiation happens by two ways. Okay, don't worry, it's very simple. The first thing, initiation. Now, imagine that I am a cell who are supposed to undergo apoptosis. Now, someone should have to tell to me from outside. Okay, you are the cell, you are supposed to undergo apoptosis. So, information is coming from outside. That is called as extrinsic pathway. Something from outside is giving signal to me. Okay, this is the time you should die. That is called as the extrinsic pathway. Now, sometimes, now the cell itself, it will recognize. Now, signaling is happening not from outside, but from inside. Now, cell, now, okay, this is the time I should die. That is the intrinsic pathway. Intrinsic pathway. Now tell me, in apoptosis, what is the first stage? The first stage is initiation, sir. Initiation. Okay, the stimulation will happen by how many ways? Either via extrinsic pathway or either via intrinsic pathway, simple. And what is the final stage? Execution. Okay. Now, question is, sir, this intrinsic pathway and extrinsic pathway is mediated by what? They are mediated by caspases. And even execution also happens by caspases. Okay, now first what we have to start? We have to start with the extrinsic pathway. First, let's start with the extrinsic pathway. Okay, so what do we mean by extrinsic pathway? Something, the signal is coming from outside. Let's take a cell here. Very simple, guys. This is a cell which is now supposed to undergo apoptosis. Okay, this is a sad fellow. Now it's undergoing apoptosis. Now in extrinsic pathway, what is happening? Signal is coming from outside. Signal is coming from outside. What is the name of the signal, guys? The name of the signal is called as FAS. Called as a FAS ligand. Okay, FAS ligand, which is actually present on the T cells. Now, on all your cells, guys, see, on all your cells, there is a receptor present. Okay, there is a receptor present called as death receptor. Death receptor or FAS receptor. FAS. It's a receptor. Okay, death receptor or FAS receptor, which is also called as CD95. Very, very important. Like repeatedly ask MCQ, CD95 is death receptor. Now, whenever this FAS ligand, whenever it will come and bind here, Okay, whenever it comes and bind here, now cell totally understood. This is the time I should die. Signal came. Okay, signal from outside came. T cell is saying, now you should die. Now what will happen immediately? Now whenever this CD95 ligand binds with the CD95 receptor, immediately what will happen is, see, this FAS receptor gives signal inside the cell that the FAS associated death domain, okay, FAD, FADD, okay, FAD, FAS associated death domain is going to be activated. Now this FAS associated death domain is the one which will convert procaspases in all your cells, in all our body cells. There are something called as the procaspases. Procaspases are inactive. So the procaspases, let me write it down here. Simple things. Procaspases. Procaspase. Remember, what is the number of these procaspases? Procaspases 8 and 10. Okay, 8 and 10. These are inactive things. Procaspase 8 and 10 will be converted into caspases. Okay, caspases. Caspase number 8 and 10. Now tell me, these caspases are active or not? These caspases are active. There is no doubt these caspases are active. Now what these caspases will do? Now these caspases, these are enzymes, right? They will actually activate, proteases, inside the cell. They will activate endonucleases, inside the cell. So proteases and endonucleases in the cells are activated by these caspases. Okay, now, so this is what happens in the extrinsic pathway. Okay, actually I should not say this event, later I will say this event. So at the end, first what happens? Caspase 8 and caspase 10 are produced in the extrinsic pathway. Okay, now what happens in intrinsic pathway? See, in intrinsic pathway, what happens? Is there any signal coming from outside? Definitely no. So let's take a cell here. In intrinsic pathway, what happens? So this is very, very important. Normally, now this is a cell. Now it is having some stress. Okay, there is no signal, just the cell is under stress. Okay, like hypoxia, something. Now see, now whenever the cell is under stress, normally inside the cell, there is this nucleus present. Okay, inside the nucleus, there are stress sensors present. Okay, here inside the nucleus, there are STRES, stress sensors. Now MCQ that will come in your exam is, what are the examples of these stress sensors? The stress sensors include everything start with, like, bad, BIM, BAX, something like that. Okay, bad, okay, BIM, Noxa Puma. Okay, all these are the stress sensors all the time present inside the nucleus. They're all the time checking whether everything is right or not. Everything is right or not. When the cell is like having too much amount of stress, now what they will do is, these stress sensors are activated in such a way that they will increase the expression of pro apoptotic genes. They will increase the expression of, now they are stimulating the expression of pro apoptotic genes. Means, remember, try to understand like this. In your body, there are a group of genes called as the pro apoptotic genes, which will favor the apoptosis, which will favor the cell death. At the same time, in all the cells in your body, there are certain genes called as anti-apoptotic genes. They don't let the apoptosis to happen. Normally, in our healthy individuals, like, in normal cases, just see, you want your cells to live. So anti-apoptotic genes are more expressive. Anti-apoptotic genes not let the cells to die. But right now, what is happening? There is so much amount of stress. Now that stress will activate the stress sensors. Now what is happening inside your cell? The pro-apoptotic genes are now more expressing. And what happened to anti-apoptotic genes? Anti-apoptotic genes are going to decrease. The expression of anti-apoptotic genes will come down. Now question comes, what are the pro-apoptotic factors or pro-apoptotic genes? Pro-apoptotic factors, okay, pro-apoptotic factors and anti-apoptotic factors. Okay, so pro-apoptotic factors and anti-apoptotic factors. Just give me a minute. Okay, now guys, can you tell me what are the pro-apoptotic factors? The genes which will cause the cell death, which will cause the apoptosis to happen. Can anyone? See, the examples are backs, BCL, XL, okay, sorry, not BCL, XL, it's BCL, XS, okay, BCL, XS, and P53 genes. See, these are example of all these what and all I have shown you here. All are these examples of the pro-apoptotic factors. Pro-apoptosis means they will favor the apoptosis. Now, this expression is increased. The expression of these factors or these genes is increased. Now, what are the anti-apoptotic genes? Now, anti-apoptosis means the BCL family, mainly the BCL family. BCL2, main thing, BCL2, BCL1, okay, so not BCL1, it's MCL1, BCL2, MCL1 and BCLXL, okay, these all are the anti-apoptotic factors, okay, all these are the anti-apoptotic factors, MCL, okay. Now these are anti-apoptotic factors. Now what I have explained to you, all these anti-apoptotic genes or factors are going to decrease their expression, pro-apoptotic factors are going to increase their expression. Now what will happen at the end of the day? Stress. Now the stress, stimulating the stress sensors. Now stress sensors are activated. Now what they will do? Whenever there is stress, now okay, this is the time you have to die. Cell, like the information is given to the cell that this is the time you have to die. Now see, normally, let me show you what happens. In a cell, there is an organelle called as mitochondria. Okay. Here is this mitochondria. Now, in the inner membrane of mitochondria, there is a substance present called as a cytochrome C. Cytochrome C is present. Okay, in the inner membrane of the mitochondria. See now, normally the cytochrome C is prevented to release into cytoplasm. Normally, the cytochrome C will never come into the cytoplasm. Why? Why? Because the anti-apoptotic genes like BCL2. See, BCL2 is anti-apoptotic, right? We just have discussed BCL2, the main important thing. So this BCL2, it will never allow the cytochrome C to enter into the cytoplasm. It will never allow. But right now, what is happening? The expression of anti-apoptotic genes. Now, this anti-apoptotic genes expression is now going down. Now, what will happen? Now, cytochrome C will leak into very, very important event. Cytochrome C, what is happening? The cytochrome C is now leaking into the cytoplasm. Now, what happens, sir? Now, whenever the cytochrome C, when it leaks into cytoplasm, now the cytochrome C, it will bind with substance in the cytoplasm called as APAF, apoptosis activating factor. APAF means apoptosis activating factor. Now what happens? This APAF, okay, this APAF along with the cytochrome C. Now this complex is called as the apoptosome. This complex of cytochrome C and APAF is called as apoptosome. Now this apoptosome, do you know what it will do? Now this apoptosome will convert the procaspase 9 into caspase 9. Procaspase 9 is being converted into caspase 9. Now, at the end of the day, in the cell, we are left with caspases. Here, in the intrinsic pathway, we have caspase 9. In the extrinsic pathway also, see, in the extrinsic pathway also, we left with caspase 8 and 10. Now, tell me guys, see, these two caspases, this caspase and this caspase, are they initiator caspases or executionary caspases? Right now, what we are discussing? So, we are discussing about the initiation phase. Initiation phase happens by two pathways, extrinsic pathway, intrinsic pathway. So, now my question, direct question, what is the initiator caspase in extrinsic pathway? So, the initiator caspase in extrinsic pathway is 8 and 10. Okay, 8 and 10. And what is the initiator caspase in intrinsic pathway? In intrinsic pathway, it is 9. It's 9. Okay, it's 9. Now, at the end of the day, we are left with the caspases. Now, what will happen? These caspases, what they will do? See, these caspases, either it is 8 or either it's 9 or 10. Okay, 8. Just let me write down here. So 8 or 10 or 9. These two are coming from the extrinsic pathway. This is coming from intrinsic pathway. What will happen? Now these caspases will activate caspase number, important caspase number 3. This is the final caspase, guys. This is the real caspase. So it will cause the activation of proteases inside the cell, proteases and endonucleases. It will cause activation of proteases and endonucleases. So once the proteases and endonucleases are activated, what will happen? Proteases will destroy all the proteins inside the cell. Endonucleases, see, endonucleases, these endonucleases will go inside the nucleus, break down the chromatin material into pieces and pieces. Okay, now, so endonucleases will break down the chromatin. So what will happen? Cell will be dead. Cell is absolutely dead. So this is apoptosis. See, there is a lot of pathways, right? There is a lot of things which are going in a sequence. Like in intrinsic pathway, extrinsic pathway, both the intrinsic pathways and extrinsic pathway should have to activate the initiator caspases. Later, the initiator caspase should have to activate the extrinsic executionary caspase. The executionary caspase number 3 should have to activate the endonucleases and proteases. So at the end of the day, cell is dead. So apoptosis is happening in a sequence. So that's why we call it as a programmed cell death. Okay. Now what happens? So the entire cell is dead and now the cell is becoming into small pieces. Now cell was chopped down into small pieces. Now these small pieces left over are called as apoptotic bodies. Okay, these small cells are called as apoptotic bodies. But do you actually need these residual bodies, apoptotic bodies? No, we don't want them. We have to clear them. Now remember, all the time, even in physiology I have explained to you, a cell which is undergoing apoptosis, when it knows I am going to die, when a cell is undergoing apoptosis, do you know what will happen? Actually, this is a cell. Normally, there is a phospholipid called as phosphatidylserine. This phosphatidylserine is something expressed intracellularly. It's all the time present towards the cell, inside to the cytoplasm. It's never expressed outside the cell. But when a cell is undergoing apoptosis, do you know what will happen? Now that cell will do something called as a flipping. That phosphatidylserine is now going to be expressed on the outer surface. Now what is who exactly is this? It is called as phosphatidylserine. So phosphatidylserine is being expressed outwards. Okay, now why I am discussing all this is because see here also on the small apoptotic bodies, phosphatidylserine is present. Now this phosphatidylserine is recognized by the macrophages, and macrophages will come here and will take out all this residue. Okay, phosphatidylserine it is going to be recognized by the macrophages. Okay, macrophages, and macrophages will remove these residual bodies. Okay, and if you want to know, yes, Nagesh, you are true. What exactly is this annexin 5? Annexin 5 staging, it's not a staging, it's a staining. Okay, annexin 5 is a staining process. Now, normally, if you want to know which cells are undergoing apoptosis, okay, if you want to know which cells are undergoing apoptosis, now you can put a stain called as annexin 5. Annexin 5 is a stain. Annexin 5, it will come and bind with. Okay, let me show you here in a much easy way. Even in general physiology class, I have explained to you. Normally, this phosphatidylserine, see, here is the phosphatidylserine. In a normal healthy cell, it's all the time expressed inside the cell. So that annexin 5 dye, okay, annexin 5 is a dye. It can't bind. It can't bind. But in a cell which is undergoing apoptosis, what happens? See, flipping is happening. Now the phosphatidylserine is now outside. So that whenever you put annexin 5, what happens? That annexin 5 is going to bind with the phosphatidylserine and it will give the fluorescence. So that's why we call the annexin 5 as a marker. Okay, annexin 5 is a marker of apoptosis. Okay, you can know which cells are undergoing apoptosis. Done. Now, let's see the difference between the necrosis and apoptosis. See, here this image is very important. Now, in necrosis and especially in apoptosis, what is happening? At the end, I have explained to you. Caspases are activated. Caspases will further activate endonucleases. Now, this endonucleases will go and chop the DNA material into small pieces. So, whenever you do a study called as gel electrophoresis, in apoptosis, see, in apoptosis, you will get a pattern something like this. In gel electrophoresis, you will have like the DNA, the appearance of the pattern of the DNA will be like a step ladder pattern. It's called as step ladder pattern of the DNA. So step ladder pattern is seen in which type of cell death? See, DNA is getting broken down, right? The DNA is getting chopped into small pieces by the endonucleases. So whenever you do a study called as gel electrophoresis, now the DNA material now it's aligning to small pieces. So this is called as a step ladder pattern. But in a cell which have undergone necrosis, if you do gel electrophoresis, it will give a pattern which will look like a smear. Okay, this is smear pattern. So smear pattern. So smear pattern is seen in which type of cell injury? Not cell injury, cell death. Which type of cell death? Necrosis. Which type of cell death you will see step ladder pattern? It is apoptosis. Okay. So with this, we have discussed the two important types of cell death, that is apoptosis and necrosis. Okay, gel electrophoresis is going to be show a step ladder pattern in apoptosis and smearing pattern in the necrosis. But important thing is the smear pattern can also be seen in apoptosis. The step ladder pattern can also be seen in necrosis, but usually saying necrosis smear pattern, apoptosis step ladder pattern. Okay. Okay, guys, we have discussed the most of the important points. Just we are left with the necroptosis and pyroptosis, and few important points were there. In the next part 2 of the cell injury, tomorrow's class, we'll complete the necroptosis, pyroptosis. Along with that, let's also start discussing about the cellular adaptations. Okay, very important. Hope the class is helpful. Okay, if you have any doubt, just put it in the chat box. Okay, guys, is it clear? Okay, guys, see you tomorrow. Okay, the PDF will be shared in the Telegram. Okay, the PDF will be shared in the Telegram group. See you in our next class. Thank you. Bye bye.